Hello and welcome back to the NWR Virtual Healthcare Conference. My name's Matt Wright. Next up, we have PainChek, which is listed on the ASX under the ticker PCK. And joining us from PainChek is the CEO, Philip Daffis. Prior to PainChek, Philip's previous roles included VP of Global Marketing at Cochlear and Global Marketing with Roche Diagnostics, based in the German headquarters of that company. Before we get started, a reminder to everyone, if you have a question, please feel free to submit it using the Q&A panel within Zoom, and we'll get to those at the end. But I'll pass it over to Philip to go through the slides first. So please go ahead.
Thank you, Matt, and welcome to everyone, and thanks for joining us this afternoon. I'll be presenting the PainChek results for the December quarter and the overall business progress of the company. As you'll see today, PainChek is progressing very positively on all fronts and positioned for accelerated growth, given the opening of the aged care, hospital and home care markets. In fact, all the drivers that were in place for the business at the end of 2019, prior to COVID, are back in place, and we are significantly better positioned with positive outcomes in our data and partnerships to drive new global sales opportunities. Now, one of the positive results of COVID is that governments globally recognise the need to better manage social care, the importance of moving to AI and digital technologies to drive that change. That's happened everywhere around the world. In addition, families are encouraged to continue to take personal control of their health matters and shift to home care wherever possible. And these drivers are accelerating access to and demand for technologies such as PainChek. For people new to the PainChek story, a quick overview. The PainChek Adult app is a first-to-market pain assessment technology using AI and smart automation with regulatory clearance in multiple markets and patent protected. We have a dominant position in residential aged care in Australia and New Zealand and rapidly growing in the UK. We're expanding our presence in Europe and the United States, where we're going through FDA clearance as a de novo technology this year. We've now got more than 20 international partnerships to penetrate the residential aged care, the hospital and home care markets. These we've developed over the last few years. We've also developed an infant app that's a significant opportunity as a home-based parental tool to assess and manage their infant's pain. Now, pain assessment is difficult, especially for those who can't communicate effectively. Our original mission, was to give a voice to people who cannot verbalise their pain. On one extreme, this is adults, such as those living with dementia or cognitive impairments, who've lost their ability to communicate effectively. On the other hand, pre-verbal children who have not built those communication skills as yet. So we've developed a PainChek app using AI and smart automation for both of these vulnerable groups. Now, these are significantly large markets. There's more than 57 million people living with dementia, growing to 150 million by 2050, with no cure or effective treatment in sight. People living with dementia triangulate between living at home, in an aged care facility, and hospitals. And in hospitals, they occupy more than 30% of hospital beds at any one time. So our adult technology has opportunities in the home care, aged care, and hospital sectors. The infant app actually dwarfs the adult marketplace with 150 million newborn children every year and 400 million below the age of 3 years. These are pre-verbal children. So we see the infant app as having a significant home-based opportunity for use by mums and dads in a similar manner as they use a thermometer today to assess their child's temperature. But now with PainChek, they can also assess pain severity for their child, and they can do that in 3 seconds. So we start our journey in aged care because that's where the pain problem is really significant. 80% of people in aged care experience chronic pain, and chronic pain is a long developing syndrome. It's subtle in nature, much more subtle than acute pain, which is severe and sudden. Now, 70% of people in aged care are living with dementia, and about 50% of those have undetected and untreated pain. And that's because pain can be really difficult to assess. It's because of the experience of pain, which is influenced by psychological, biological, and social factors, and it can change any one time. Pain is also multidimensional. You've got to assess it by both verbal and non-verbal means. And it's highly subjective personal experience. It varies greatly from person to person. Therefore, good pain assessment requires significant investment in training, education, and reporting to show that you're doing it well and you're delivering care. And that's made harder today by high turnover of professional staff in these areas. So there's a clear need for an objective and easy to use pain assessment tool. Historically, manual tools such as the Abbey Pain Scale, you can see on the left of the screen here, were developed for this need and found broad use in multiple markets, including the UK, Australia, and the United States. However, the Abbey Pain Scale was difficult to implement in practice. It's subjective, it's largely paper-based, and it's not used at the point of care where you must really do pain assessments. Additionally, it doesn't integrate with other digital clinical systems, which means that data captured can be inconsistent and may lose integrity. Now, we're delighted to advise Dr. Jennifer Abbey. I've been working with Jenny for 3 years now. The inventor of the Abbey Pain Scale is actually one of our biggest supporters. She's on our advisory board and she promotes us wherever and whenever possible. This quote from her, I think, is typical. She says, PainChek ensures an evidence-based assessment of pain can be made at the point of care, and it's digitally linked to other systems, making information quickly available to prescribing physicians, as well as guiding nursing staff in dispensing PRN or pain medication. So PainChek is the evolution and the solution for pain assessment, and it's great to have Jenny with us as part of the journey. So let's look at the PainChek app quickly. So PainChek, as I said, uses AI technology and a camera and a smart device to complete a facial assessment, the most complex part of the multidimensional pain assessment, and it does this in a 3-second analysis. And that time it analyzes the facial expressions of pain and records them for the nurse and carer. Then the PainChek app guides the nurse using intelligent automation through the remainder of the pain assessment process with the result of a pain severity score. This can range from no pain, mild, moderate, or severe, and then it's date and time stamped. The results are documented in real time and transmitted to the electronic medical record to determine the treatment plan. That all happens in a matter of 2 to 3 minutes. In addition, in a digital technology, PainChek can provide the education, we provide the education, the training, and a fully digital platform and available 24/7 online. So in summary, easy to use, fast and accurate pain assessments, and available for use by all nurses and carers. The other thing we do with PainChek, and this is something we've evolved in the last couple of years, is that we document every pain score on our back-end system. And we've built up an analytics platform that allows that data to be analysed by our clients and by ourselves. We provide our clients with access to Paycheck Analytics. They can track their residents' progress in terms of their pain management and share these results with colleagues, with doctors, with GPs for use, and also for use for accreditation and audit purposes. This is becoming a really important part of the care practice. So the PainChek data analytic is almost becoming as valuable as the app itself to our clients. And it also provides us a wealth of information to further develop our product and technology and produce clinical outcomes data, which I'll come on to. For both the adult and infant technology, we've got 2 business models. At the top there, we have an enterprise, a business-to-business enterprise license for sales into the healthcare settings, such as aged care, hospitals, and primary care. And we also provide a subscription model for selling directly to carers, be it mums and dads or family members, through the Apple Store and through other outlets. To date, we've focused on the top part, really. Most of our sales has been through our enterprise license, selling into aged care and now into hospitals. However, we see the transition or the shift moving to the consumer side or the subscription model as more home care services and family demand increases. So in simple terms, we're well placed to deliver on both. This is a summary of the global market for the adult product in that sort of dementia, enterprise and home care area. As you can see there, the enterprise dementia, the aged care market opportunity is more than $300 million. We've already penetrated somewhat into the Australian, New Zealand and UK markets, and we've actually got our first sales also in Canada. So we're starting to penetrate into 3 of those segments into the aged care sector. We believe the home care sector will be the largest sector in the future. It's significantly larger, about 10 times the size, as more and more people with dementia will be living and treated at home along with those home care services. So while we've just started to penetrate the home care sector smallly, that market will grow significantly as home care becomes more the norm in the future. And again, we're well positioned to be part of that journey for people with dementia who go through those different phases. So how are we progressing? Well, this is a little map of where PainChek's present in Australia. And I use this map because, PainChek now is actually aged care's most popular digital clinical tool. There is nothing out there that does a clinical assessment digitally that is used more in aged care than PainChek in Australia. We've had it used in up to 1,500 facilities around the country, and we now have agreements with more than 600 aged care homes, commercial agreements covering more than 45,000 beds, more than 20% of the Australian market and growing. You can also see here we've got some significant partners who've signed up for us, and these sign-ups are continuing monthly, daily, weekly, as people transition from the old system to the new. So we've positioned well, and we've continued to grow rapidly in the Australian market. We've also, in Australia, we by default entered into other markets. Disabilities, Nonson Group contacted us, and now they're using PainChek as part of their disabilities under the NDIS. And we've got actually more clients there wanting to use PainChek where they can. We've got our first hospital sales with Joondalup in Western Australia. And of course, with our inter-systems agreement, this will expand rapidly now. And we've got our first few aged home care agreements with Finley Regional Care and St Louis Aged Care in South Australia. But really interestingly, we've also got our first New Zealand agreement, and that's with Somerset Group. They're the third largest residential aged care provider in New Zealand. And we actually contract with them during COVID. We piloted the technology, we trialed it, they signed the agreements, and we've rolled it out without actually going to the country. This shows you how digital we are in nature and how good the technology is. Let me share with you a summary from Somerset. They just released their annual report, which was literally last month. It's a great quote. They've now got PainChek across 20 facilities, more than 1,100 aged care beds. And it says very simply here, it says, this smart system, being PainChek, is far faster and more accurate than the traditional pain assessment tools. It helps vulnerable residents, it frees up our staff to do more for our residents by automating many of our processes. This quote is actually what we've been saying for ages, and that was our goal, and therefore it's great to hear it from customers that are actually delivering on our promise. I'm going to shift to the UK market, because the UK market is really starting to take off for us through government funding as well, and local council funding, and just the take-up of PainChek in that market. So as of December, we had 10,000 contracted beds, and I'll report on progress at the end of this month for this quarter. And 6 of those were live, and 4,000 were being implemented as we talked. And we continue to grow new clients. We've got a strong pipeline and receiving new funding from local governments. It's called ICBs, local councils, and they're providing funding for their local aged care groups, which is great. We're also signing up residential aged care clients directly, including, you can see there, Silverline, Mission Care, Cornerstone, South Care, and Colton Care. These are all new clients, and we can see really good progress in the UK. Like Australia, we've integrated with all the major medication providers, endorsing the technology and driving better care. You see a couple of quotes on the right-hand side, one from the CEO, from Sam Hussain, CEO of LogMyCare, who've become now a reseller of PainChek for their clients, and then also from Cheryl Baird, Director of Quality Care at Orchard Care Homes. Now, I want to talk a bit more about Cheryl Baird's work, which is stunning in the UK. So I've reported this before, but now I've got some updated data on the impact PainChek's had at Orchard Care in terms of improving care outcomes. So Orchard Care into their second year of PainChek use across 24 homes and more than 1,000 beds. As part of their quality and reporting system, they track changes in care post the implementation. On the left-hand side, you can see the first year focuses on increasing pain assessments to improve effectiveness of pain relief, and it's impressive in its impact on reducing safeguarding incidents and distress behaviours. On the right-hand side, you see the second year outcomes, which are stunning. This includes significant reductions in the use of antipsychotics and benzodiazepines. And these are drugs which are typically last resort drugs to be used to manage residents' behaviours or alter sleep patterns. Now, the reason why reducing this is good and treating with pain is because the issue here is that typically often observed behaviours in aged care, such as aggression and poor sleep patterns, are sometimes driven or often driven by another underlying cause, such as pain, and not by the dementia itself. If you identify and treat the pain, you can address the behaviour and reduce the need for such interventions, as shown by the aged care results. It also reduced the cost of care because these drugs are really expensive. Now, this is very high level, but these results are being published in a peer-reviewed journal, and this is highly influential in the UK market and will be influential overseas as people see how they can better manage care in those social environments. So, business progress, as of the end of December, we had 45,000 licensed beds, which were not just licensed and commercial, but also implemented. We only recognise revenue for implemented beds as well as commercial contracts. There's 45,000 beds, resulting in around 2.1 million ARR. If you look on the right-hand side, we also have a qualified pipeline. This includes 10,000 beds that are on commercial contracts, but not yet implemented at the time, but they have been implemented in the past quarter. And a number of clients that were on government grants that are still in negotiation to move on to commercial agreements. So in total, although we were actually at 2.1 recognised, we had that qualified immediate pipeline of close to 100,000 beds, around $4 million ARR. Now, I repeat, that does not include new pipeline clients in Australia, New Zealand, UK, Canada, which we'll report on next quarter. And moreover, the current 4.4 million would broadly cover our core costs in Australia, our core operational costs, and that's at achieving 1.5% penetration of the global residential care market. That just shows you, it demonstrates the scalability of this business. So in terms of our progress and expansion, we have now more than 20 global integration partners across multiple markets, including now New Zealand and North America, UK, and of course, Australia. These are key to our growth. They do two things. They ensure our technology integrates into their client, our client's EMR system, saving time and effort and supporting better care. But also, more importantly for us as well, they collectively provide us access to more than 1.5 million aged care beds between them. That's 15 times our current bed numbers. And some of them are starting to become resellers. So these partnerships, not only are they important, but also growing, and they're key to our global growth. One of those partners is PointClick Care. This is one of the leading care management system and EMR system providers in the US and Canada, and they cover more than 1 million beds in those markets. We've already got 2 commercial agreements in Canada that are using PointClick Care, and we're scheduled to go live with them in Q2 2023. So PointClick Care and InterSystems, we'll come on to next, are 2 US-based partners who are now in place in the US for our market entry in 2024 post FDA clearance. So let me talk a little bit about our partnership with InterSystems, which is a really, really exciting partnership. Let's talk first about the challenge in hospital to assess pain. And the problems of pain management seen across the whole of hospitals, ranging from acute pain at presentation in the emergency room to post-operative pain following surgical procedures. Hospitals are keen to optimise the use of their hospital beds and return patients home as soon as possible for very multiple reasons: the cost of the bed, the risk of infections, and all those elements. However, if pain isn't managed effectively while the patient is in the hospital, it can lead to a delirium, either in the hospital or afterwards, and can lead to intensive care treatments, which is a very, very high cost. We stated earlier that more than a third of hospital beds are taken up by people with dementia, and this complicates the matter even further. Let's talk about that. So if you don't manage pain effectively for people living with dementia, there's significant issues. People living with dementia in hospitals typically stay in hospitals up to 18 days longer than the average patient. They're 3 times at more risk to a delirium, and consequently, that's partially due to the lack of effective pain assessment tools. They receive significant high use of antipsychotics, and the use of antipsychotics typically effectively drives the longer stay in hospital. So this is a self-perpetuating issue. The good news is PainChek is here to help, and with InterSystems, a global US-based hospital provider, they've recognized this issue, they've recognized a partnership, and we're working together now to solve and address this problem. So we've announced last month, we announced in November, last quarter, that we partnered with InterSystems to take our mobile technology to global setting. InterSystems themselves are one of the world's leading middleware and electronic medical record companies servicing hospitals and other sectors, including primary health and pathology. In simple terms, they ensure that clinical data, things like vital signs such as blood pressure, pulse and respiration data, gets transferred from the point of care or from the bedside in the hospital into the electronic medical records, enabling better workflow and guiding better clinical decision-making from nurses and carers. Our collective goal is to ensure PainChek data gets recorded at the bedside, at the point of care in the same manner, making PainChek in the future the fifth vital sign for use in the hospital setting. This TrackCare is actually the EMR system that's within the InterSystems group, and that brand, they cover more than 100 million patients in hospitals and 27 countries. So our first step has been to integrate PainChek into the TrackCare platform to run these pilots. Let's see how we're going. So in the past weeks, we've built the first version of the hospital system and the integration, and I saw the demo last week with the TrackCare UK team, and it's remarkable. A PainChek pain assessment conducted at the patient bedside transfers automatically into the TrackCare system, recording the data points and all the graphical trends. And it sits alongside the other vital signs as data points. It's our collective goal to turn this into useful clinical decision support information that can drive three things. Firstly, early warning alerts of a deteriorating patient. Secondly, better medication management. And thirdly, reducing the risk of delirium and the number of days stay for many of their patients. We do have our first group we're working with now in the UK, the first hospital. We're actually presenting to them in the next couple of weeks, and the goal is to start the first pilots as soon as possible. In addition, I'm pleased to say that we've been invited by InterSystems to demonstrate this PainChek integration on the InterSystems booth at the Global HIMSS conference. That's a Health Information Management Conference in Chicago on the 17th to 21st of April. This is a global event with more than 40,000 people in attendance. So we'll be on their booth. It's an enormous booth, apparently, and they'll be bringing all their clients to it. In addition to this, I've been invited to give a keynote speaker at the InterSystems Global Leadership Conference in Miami in June this year, where more than 1,000 of InterSystems global customers, many from the US, will be invited to, who come to hear about new products and initiatives. So this is a really positive and collaborative relationship. Just touching on market sizing, if we can get to $1 per day into this sector, this is a significantly large market for hospitals. It's $1 billion annual market in our initial focus of Europe, North America, and Australia, New Zealand, and it's a $2 billion global annual market. So we're starting on something that could be very significant. I put this picture in just as a summary, because I've covered all these points, but what I want to point out here is that today we are far more progressed and far more mature than we've ever been in terms of our product, our sales, our partnerships, and our global market penetration. Today, we're light years ahead of where we were back in 2019, prior to the COVID breakout, and I think people should recognize that. In addition, our team is stronger and has global capability to where we previously were. So we're well positioned to consolidate our growth and become that fifth vital sign. Finally, on the infants, just quick update progress. We've commenced direct-to-marketing testing with our infants with family members. We're building more healthcare professional reference centers, and we're now building also a new vocalization feature, all of which will make the infant product stronger for use in the healthcare professional and in the direct-to-consumer setting. Just to reiterate, the children's market size is significantly large. It's 140 million kids between the age of 0 to 1. And we just got 1%, just 1% of that global market. It's worth more than $300 million per annum. So again, it's a significant market. Finally, obviously, our corporate summary. Thank you to our shareholders for our support through this very difficult macro environment situation globally. Our market cap is of 36 million. The board and management shareholding remains stable. It's close to 2%, 5% of the company, and we have no debt. Now, every CEO believes the company is undervalued. What I would say is that I don't think our value today represents the progress we've made, especially in the past year. And it also does not represent our global growth opportunities that we now have in place directly ourselves and with our partners. And I'd like everybody to reflect on that. So I will finish on this slide and then go for questions, but final comments from me. So we will continue to update you on our progress for the next months, and we'll continue to expand our commercial sales, and we'll continue to expand our partnerships globally. We have our FDA work clearance well underway now, so we're ready for the US market in 2024, and we're embarking on a direct-to-consumer program for the infant app. Finally, hospitals, very exciting, and we're looking to expand that opportunity within systems internationally as a new market entry. I'll hold it there and pass back to Matt.
Thanks very much, Philip. We've just got a few minutes, so I'm just going to fire a few sort of quick fire questions at you, and we'll get through as many as we can. So the first one is, has Duke University commenced the study into high-quality clinical assessment outcomes and endpoints to effectively measure acute pain in infants?
I believe they have. It's an independent study. They approached us and we provide them with our PainChek data. So we've submitted our data as part of the study. It's a 2-year study, and I think the outcomes will be out there in the next 6 months to a year.
Great. The next one is, can you provide an update on the Boots-Walgreens partnership and what should we expect if it's successful?
Yeah, look, we're still talking to Boots-Walgreens. They have had some reorganisations within the company which has slowed things down. Just 2 weeks ago, they told us still their intent to progress with us. What I would say is that in the meantime, we've started to negotiate directly with some of their big aged care clients, which, if we're successful, means that if we get those sales before the Boots agreement, means we'll take the full margin, which is better for us as a business, but we still want that partnership.
I know you touched on some of it, but can you just talk to the positive news flow you're expecting in the next 6 months?
Yeah, look, I think just leaving this up, we have a lot of good news flow. I'm really excited about the growth. I mean, the outcomes data we have from the UK is going to drive growth significantly, not just in the UK, but around the world. The hospital systems, hospital partnerships, we see that going significantly. We're talking to 2 countries with InterSystems to start that process. And we're looking to really start moving now with the infant consumer products direct to parents and get some traction there. So all of these will be significant as we get ready to go into the United States market next year.
Great. Will the UK NHS potentially fund PainChek rollout similar to what the Australian government did?
Well, we're already getting funding from local governments and local councils, so that's happening already. And the UK government have announced 150 million fund for digital technologies to go into aged care, and we are positioned to get onto that preferred providers list in the next month or 2. So we're already receiving some, and we think we'll get a chunk of that 150 million as that rolls out into aged care.
Another question that came through late was, do we have a specific timing of when we think PainChek Infant could be purchasable from the App Store by parents?
Very good question. And look, once we've done our parental feedback, we're using that to refine the marketing mix. When we get that ready, we can post it up onto the App Store with the necessary education and guidance that we'll need for parents. And then it's either going to be a monthly or a single year purchase. We're going to work out which way that will go.
Another question was, I'm not sure if I've got the spelling right here, but Care Inspectorate Scotland is trialling PainChek at multiple sites. When will the trial be completed?
Well, actually, they've just actually expanded it. So they've actually just provided a bit more funding to expand it further. So that's still ongoing, but it's now expanded. So I'll report more on that in the next quarter.
And last one is, when will InterSystems begin trialling PainChek in hospitals?
Well, our demo is happening the next couple of weeks in the UK. And if that all goes to plan, plus we have another market we're looking at in Asia to do that as well. If that all goes to plan, we could be actually going to demonstration in the next month or so.
Great. Well, that was excellent, Philip, and very good on the quickfire answers. So we'll leave it at that. Thanks very much for the presentation today, and we look forward to hearing more from PainChek. We've just got one more presentation left in the conference, which is robotic surgery evolution, which is up in about 10 minutes time. So hopefully you can join for that. But thanks again to everyone for joining and hearing from PainChek and Philip today.
Yeah, thank you, everyone. Thanks for your time. Really appreciate it.